We now turn to our next speaker, Chloë Keegan from the National Disability Authority in Ireland.
Thank you. Hello, everybody. I will make sure to stay with the yellow card. I won't go near a red card, I promise. So, thank you very much for being here. My name is Dr. Chloë Keegan, and I'm a research officer with the National Disability Authority. Today I'm going to be talking about a literature review that we've been doing for Action 1 of the Autism Innovation Strategy. It's talking about addressing public attitudes, a pathway to enhancing autism inclusion and rights in Ireland. Great, that does work, wonderful. Okay, so for people that don't have an idea of the Autism Innovation Strategy or haven't heard about it before, it's a structured 18-month plan, it's cross-governmental, and it increases supports for autistic people in Ireland. It includes 83 actions, and the National Disability Authority were assigned multiple actions, and the one I'll talk about today is Action 1. So Action 1 was to synthesise the existing data to do with attitudes with autism in Ireland. So as you can imagine, for any of my researchers here in the audience, this is quite a specific piece of work, and there was a lot of limitations to the data that we could generate. So I'll talk through that as I go through it. The research questions that underpinned this work was, firstly, what is the current level of knowledge? So any data that exists on current level of knowledge of, firstly, the public, and then specific professional groups, so for example, education professionals, healthcare, and people that work in the justice system. The second one then was what attitudes were held by the same groups. And the third one was very specific to this action because, of course, we're looking at public campaign effectiveness. So we want to determine, well, what is an effective public campaign? And if a public campaign is even effective to do what we're aiming to do, which is improve attitudes towards autistic people in Ireland. So it was a scoping review, which is how we structured the piece of work, and existing data was searched for under, firstly, knowledge and attitudes for the specific groups that were identified, and then separately then we were looking at public campaign effectiveness, which included evaluations of campaigns, which also were very, very scarce, and then any additional studies then that could give us more information on public campaign effectiveness. So with the limited data, particularly to do with the public campaign evaluations, we needed to be a little bit more creative and just look at it slightly differently. So what we did instead was look at, okay, do we have any public campaign evaluations that are based in Ireland that could be applicable to the autistic specific topic or discourse? So we looked at evaluations that were targeting or improving knowledge and our attitudes in the public, specifically in, say, education and healthcare, for example. And then those additional studies then fed into that gap in data. So findings for yourselves now were broken into all these different categories. So to start off with, in terms of knowledge, we were looking at the public, and the more positive thing that we found was, yes, autism knowledge is increasing, and this data comes from ASIAM's annual survey from 2024 and 2025. But what I did find in other data was that while knowledge is increasing, the depth of understanding of autism is surface level. So what I mean by that is, if someone was to ask, what is autism? Majority of people had a good understanding of what autism is, but if they were asked more specific questions on key features of autistic traits or diagnostic criteria, the knowledge wasn't there. In terms of education professionals, we had strong autism knowledge, again, across education professionals, across primary, secondary, and higher level institutions, but they struggled to apply evidence-based practices, whether to do not necessarily with a lack of knowledge, but more with a lack of confidence. And I also found that mainstream teachers, which wasn't necessarily a big surprise, did have more knowledge than, or less knowledge than special class teachers, because of their exposure was a lot less to people in the autistic community. Then we had healthcare professionals. So interestingly enough, there was a lack of autism knowledge from healthcare professionals, and it was resulting in poorer outcomes then for autistic people. And then interestingly, on the back of that, more specifically, you had healthcare professionals with lived experience. They did demonstrate better knowledge than those who didn't have lived experience of autism. And then in terms of the justice system, then there was strong autism knowledge again, but as we saw in the education profession, there was that lack of confidence in being able to feel comfortable or confident in working then with autistic defendants, for example. There was also issues with lack of knowledge on understanding how to work with defendants, which was explored more in the research that's linked here. Then in terms of attitudes, so attitudes was looked at not necessarily the same way as knowledge, because attitudes occur in the context. Attitudes don't develop in isolation. So what we did was we looked at attitudes in terms of their context. So in the context of the public, we were looking at employment and public spaces. And then in terms of the professional groups, we were looking at education, healthcare, and the justice system. So in terms of the public, in employment, 79% of people in one study said they would happily work with an autistic colleague. However, when it came to data about, say, visual aids being supplied or any reasonable accommodations, there was an awful lot more negative attitudes identified in these, which highlighted that negative attitudes are persisting on a deeper level, as we found out earlier. Then in public spaces, the social norms, so what the social norms are expected in a public place, for example, the cinema, where you're expected to sit still, be quiet, all of these social norms were very much evident in the attitude surveys that were collected, which showed that social norms were trying to be embedded rather than adapted. And in terms of parents of children with, autistic children, 64% of the public in the As I Am annual survey did believe that parents should be stricter with their children if they become loud or frustrated in settings, public settings specifically. In terms of education then, training affected the teacher's attitude. So if they had low levels of training in teaching in general, not specifically autism, they were more likely to have more negative attitudes towards autistic students. Then there was an interesting systematic level in terms of attitudes, because remember, they don't develop in isolation. So we're looking at, say, school policies and what are their values. And what was found was there were a lot of discriminatory practices that still were embedded in these systems. For example, reduced timetables, seclusion, restraints still are being normalized, which then affects how teachers interact with autistic students and then affects their experience as a result. In healthcare, you have systematic issues and stigma. So they were huge and also affected then the access for autistic patients to engage in the healthcare system. And then in the justice system, police officers had a lack of knowledge, but this actually spurred them on to want to seek out more knowledge, which was interesting because it fueled more positive attitudes. And then court officials perceived specific autistic people, for example, people with selective mutism, as being perceived as uncooperative. Lastly, then, we have the public campaign effectiveness. So across all the evaluations that I couldn't find, and all the additional studies that I could engage with, the features of an effective campaign were, in a public campaign, they're short, targeted, and have a clear message. Perfect, that makes it effective. It was also found, though, that with an effective public campaign for an autistic discourse lens, this may not be so effective, because autism is not short, it's not targeted, it's individual, it's a spectrum, it's an experience, it's a lived experience. So with that data, we had to consider this in our recommendations. Then in terms of the other data collected in terms of public campaign effectiveness, it was vital to include autistic people in design and delivery of public campaigns to ensure that their lived experience was reflected. And then campaigns, as we've heard a lot throughout this Congress, campaigns need to ensure they're not rooted in Western views of autism, because that completely isolates so many different cultures and how they perceive autism. So using all of this data, and let me tell you, there is so much more in this research that was explored, but unfortunately in a 10-minute presentation we can't cover everything. But with the end of all of this data collected, the NDA, as an advisory group to the government, would say to the Department of Children, Disability and Equality, we understand that in Action 1 we're collecting data. Action 2 is to deliver that public campaign. But unfortunately, the data doesn't really support the public campaign delivery for this topic. It may not be as effective as we would hope. So particularly a public campaign may not be impactful or cost effective because the short messaging, as I mentioned, it's going to also risk enhancing potential harmful or negative stereotypes because they're so short and so nuanced that you risk isolating other lived experiences. And then the cost of a public campaign, it would be substantial. We've heard in other seminars and other presentations the cost and the long-term push is massive. And while money isn't the focus of this whatsoever, it is making a point of resources will be limited. And if it's not delivering the outcome we want, we need to relook at the plan. So based on the review, the NDA advised targeting the negative attitudes evident in education, healthcare, and the public sector would be more effective than a broader public campaign. It would also be effective to consider professionals that don't have exposure to the disability field in a broader sense, to target those that may not have lived experience of autism or any experience of disability in their lives or professional lives. And then the last one is that you develop campaign materials always in partnership with autistic people, because you want to ensure that this campaign, when it's delivered in whatever form it is going to be meaningfully reflecting the lives of autistic people. So the link to the research is there for people. It's on the NDA website, nda.ie. The advisory paper is also on the website for people who want to have a look more into it. And do keep an eye out, because with this Autism Innovation Strategy, there's going to be an awful lot more progress towards the other actions, such as Action 2, about how we're going to form this new public campaign in future. So thank you very much.
I was going to say thanks so much, Chloe, for your fantastic presentation. So we have a few minutes for questions. So we just want to just open it up to the floor. So I'm just going to say this is going to say lady here.
Thank you for the talk, very interesting. My background is trans healthcare in Ireland, and one of the things we see is a lot of the transphobia is rooted in infantilization of autistic people. Like, for example, saying that, oh, those aren't trans children, they're autistic, they can't be that, they were convinced by social media. And we're seeing the same things, the leading doctors and so on, running to prime time, running to news talk and so on, saying, oh, we must fearmonger, please think of the children, and deny them healthcare because they're autistic. Is there anything to deal with that? Because it's not stopping. We're seeing the same internationally, and obviously it's bad for trans people, it's bad for autistic people.
Yes, so we didn't specifically, we looked at broadly people that were autistic as in terms of diagnosed, and we were looking at, say for example, population surveys that were done by the public or done by educational professionals that weren't autistic, because we wanted to understand the public attitudes. In terms of trans autistic or even people with complex disabilities. These were also feeding into it, but not necessarily the specifics. But it is being considered in the discussions, because exactly as you're saying, there's an awful lot of fear around if we deliver a public campaign that's going to be in any way harmful. That's not what we're going to aim for. And we want to make sure that there's no group that feels isolated or segregated by it. So rest assured there's a lot of conversations, but there's also more questions coming from the work, unfortunately. So do keep an ear out for it. Thank you.
So have we got one or two more questions here? So see this lady here, there, with the back here.
Thank you. I wanted to ask, did you look at anything about the medium of how to deliver campaigns? And I ask this particularly thinking about a lot of the messaging and work that's being done at the moment, and particularly there's a programme coming out shortly in the UK by Stacey Dooley that's looking at where people get their medical information from, and predominantly it seems to be off of social media.
Yes, so we did a massive scope on media platforms and what would be effective. It was found specifically for Ireland, because we have to be very context specific. Specifically in Ireland, it was found that in terms of media platforms being used, it was actually better to have a mix. So some studies had just digital platforms that were used, so for example, social media. And it was found that for the Irish context, that didn't actually work, because you have people in rural contexts, for example, that rely heavily on the radio and TV. So absolutely, so the media has been considered, and that's also feeding into the design, because now we're thinking about, well, it may not just be a media-heavy campaign, it's going to have to be potentially more targeted in schools, in healthcare settings, and so on.
So we might just take one more. We might just take one more question. So you see the lady here with the blouse there.
Thank you for the presentation. My background is I'm autistic and I work in the criminal justice system. I apologize for my peers' ignorance. Having studied law in 2 jurisdictions, I've realized that colleges don't cover how to deal with disabled clients. I know that in India we have social work and courses like that where they talk about neurodiversity, psychiatry and psychology, but not in any other professions. Therefore, the amount of time I spent training other professionals about autism, I believe makes me eligible for a discount. So my point is, instead of campaigning, along with campaigning, if you could go to professional colleges and curriculum development and go there and target professionals from the beginning, don't you think that would be more beneficial?
See, that's what we're balancing out, because one of the key things with this research was we were being very specific on identifying this is for campaign, not training. So you'll even find in the limitation of the research that we were very clear on not even evaluating anything to do with training, because it's a completely different approach with training versus an actual public campaign. But I absolutely agree that there's a lot of gaps in terms of frameworks and guidance that's going to shed a light on. So that's where we're hopeful that a targeted campaign will be able to fill into that more, and having professionals feed into them, absolutely.
Thanks so much, Chloe, again, for taking the time to answer all the really insightful questions in the room.